Hey guys, welcome to Station 1. Today is March 18th. It's about 1600 hours. We're on the back apron of Station 1 with Medic 1's crew and EMS 1. And we want to go ahead and celebrate an incident we just had and talk about it so that we all can be prepared for the next level or next call that we have over the next several months. So right now, Lieutenant Coltrane, Master Firefighter Weaver, Lieutenant Thompson right now we're going to discuss an incident that occurred about 2 hours ago. And the medic just got back from OBC, and we'll talk about decision making. We'll talk about their points of information received by dispatcher, what they did pre-arrival, and absolutely what they did at OBC. So we'll start right now with Lieutenant Coltrane. Talk about this morning and up to about the 2 o'clock hour when this call came out, how you prepared for an incident that would occur today with possible case of COVID.
Well, initially, when we came in this morning, we had a debriefing with yourself and the upper chain of command. Just going over the process to handle COVID-19 patients. That's very in-depth. Got a lot of information out of it because as we know, excuse me, as we know, updates occur very frequently. So we got the updated information this morning, so we got prepared for this medic shift today.
Okay, very well. So medic was yourself, Master Firefighter Weaver. And let's talk about some of the information or decision making you did at the table today about location of your medic unit, dispatch protocols, EMD that occurred, and how that played into the response.
Yeah, so when we talk about medic placement or just en route to the call, once we get it, we got a lot of good information from our dispatcher asking the questions that need to be asked prior to us getting dispatched. So we had information on the way there that we definitely utilized. But in planning this morning at the table, we definitely talked about the spacing, the distance between us and the patients, as well as the ambulance and the in the house itself. So all that came into play as we responded, and worked out pretty good.
Okay, very well. Lucas, let's talk about now. The bell goes off, you're activated for a run. Talk about how that decision making went through your mind as you're progressing to. It's in Station 1's areas where we went. We're going to leave the address out, of course, for patient confidentiality. But as you're progressing to this priority 2 case, what was in your mind?
Like Lieutenant was saying, the information that the dispatcher gave us led us to believe that it was a possible COVID-19 case. So on the way to the call, we were discussing the PPE kits and how we were going to proceed once we arrived. We discussed stopping short of the house and leaving some space, and that Lieutenant Coltrane was going to approach initially and find out what exactly the situation was, and that I would remain in the medic until we determined whether I was needed or not.
Okay, very well. And so, Lieutenant Coltrane, as a paramedic on this unit, how did you, upon arrival to the patient, how did you approach not only the patient, but the situation so you start gathering information?
Once again, our training always comes into play, and communication is always key. So myself and Master Firefighter Weaver got a game plan together. Not to say it, but we actually stopped. It was a priority 3 call, so we actually stopped, got a game plan together, got all our PPE together, and proceeded in. Actually, even looking up the direction we were going to go into the neighborhood, into the residence, and even when we got to the house and on the street, threw a little wrench in it, if you could say, because they had 4 houses and 2 houses were in back. So now we are tasked with just weaving through and which house is the house in question where our patient was. But once I arrived, EMS 1, Lieutenant Thompson arrived along with us. So he definitely helped us out a lot, came up with some good information. Once again, game planned again, and approached the house just from a distance. She met us on the porch. We kind of gauged that distance to stay back just to get more information and proceed in further.
Okay, very well. So we talked about EMS 1 and how EMS 1 integrated this. Can you tell how you learned about the situation, how you responded to with Medic 1?
Yeah, when the call came out, of course, I had my radio on, and I heard dispatch say it was a COVID-19 possibility. So I responded along with them, and I'm sure they were talking about their plan, because that's what we do. Once I got there, the caregiver had met us outside, and I talked to her at a distance to try to get the information that was useful to us. And once we determined some pertinent information, then I contacted OBC, and I talked to one of the doctors to get further advice. At that time, Lieutenant Coltrane put on his PPE and went inside and did his assessment.
Let's talk about PPE. Can you describe not only the PPE that you wore, but the decision making behind what you wore and what Master Firefighter Weaver wore?
Okay, initially the game plans was for me to make direct contact. So I was going in full PPE, head to toe. We had gowns that we were supplied with by the department, and had everything ready to go. So my game plan was to make contact with the patient and do a good assessment and size up and go from there. Like we said earlier, Weaver was to stay in the medic, just so we would have somebody in the, kind of the cold zone, and I went into the hot zone, and then we can make decisions as he can work, work with the equipment and everything. So once I determined everything we needed, we minimized everything we took in or brought out to be, decon, but we just went from there.
Okay, and your PPE, please tell everybody about the PPE that was on.
Okay, so I had goggles, mask, N95 that was given to us. Had a gown on with gloves, covering as much space as possible, showing no skin, as much as possible. Also in the PPE kit, we had masks for the patients and family that were inside and on scene to make sure they were covered and safe as well.
Okay, good decision making. And Lucas, talk about what you did with the medic to prep it for the transport and how you prepared for reduction of any type of contamination in the medic.
Okay, so on a typical call, excuse me, we've got quite a few things that are out loose in the medic that we use on a regular basis, but because of this particular case, while Lieutenant Coltrane was inside making contact with the patient, I got in the back of the medic and put all of those loose items inside of compartments to limit the exposure to any of that and any waste that we may have, and limit the amount of contamination that we would have inside of the medic.
Okay, very well. Now, go back to Lieutenant Thompson now as a supervisor. You're thinking now contact with OBC by phone, tell them what we have. What was some of your thoughts now that Lieutenant Coltrane as a medic was actually physically caring for the patient, now getting prepared for a movement to OBC?
After Coltrane finished his assessment, he indicated that he felt the patient needed to go based on that. And at that point, I notified Captain Willett of the potential COVID-19, and he responded to OBC, and then we made a game plan. Once we got there, I helped Lucas out getting the stretcher to the door and getting ready for the patient to be transported.
Okay, very well. And guys, just so everybody knows that's watching this right now, it really was based on EMD, which Chief Adams, Chief Spicer has been working with our dispatcher and 911 to have all the questions asked on every 911 call, so that we can know whether it's a patient, in this case, that had maybe some kind of through the tree relationship with somebody who was on a cruise ship, all the way down to somebody who might have fallen and was able to speak when the dispatcher can talk to the family member. So we feel like that went very well. On top of that, we feel like with the recent spike in temperature on this patient and by the age, that we felt like that we should consider this to be a person of interest, a person undergoing interest, or PUI. And so by that, we don't know, we don't have the test on the medic unit. We can't sit there and say for sure that this patient has COVID, but we felt like they met all the parameters to treat as we did. So now we have a patient being transported. The medic's in the back of the truck right now, full PPE, gown, N95. The patient has a mask on. The patient's facing forward, and Lieutenant Coltrane is caring for this patient. What are some things in the back of the medic to minimize maybe being in the zone of the patient, exhaling and et cetera, that you would have to then be more exposed?
Once again, Master Firefighter Lucas Weaver did a very good job with getting everything out of the back so the contamination would be on the lower end. But as far as the patient, we had him masked up, also put on a ventilation for the back to just circulate air, push the air out, and just keep the air flowing, and so it wouldn't be all just contaminated to just in the back of the medic.
So now we're at OBC, the patient's ready to be delivered, and how do we minimize contact not only with with us as fire rescue, but how do we minimize contact with the hospital or the patients that are being seen normally in there? How did that communication go? Do you want to take that side?
Yeah.
Okay, Lieutenant Thompson.
I went in and spoke to the nurse who was going to be handling this patient and got her recommendations, the room assignment and everything. And once the patient was offloaded from the ambulance, they went straight in and went straight to the room. Didn't stop in triage along the way, just went straight to the room. And that way there was little to no contact with any other patients at that time.
Okay, very well. And then I observed at this time, we had to start now preparing the medic unit for the next run. So would you like to take that, Lucas, on tell how you prepared, and there's other people as well, but prepared this medic for service?
Yeah, so once the patient was removed, the doors were left open just to let it naturally ventilate. And while the lieutenants were inside with the ER staff turning the patient over, we've got a solution that has been approved to decontaminate for COVID-19. So the entire back of the medic was sprayed down with that solution and wiped down. Any disposable products that were inside of the medic that had been in contact with the patient were properly disposed of at the hospital, and the total process took approximately 15 or 20 minutes to return the medic to full service and properly decontaminate.
And very well, and so everybody knows this, at the same time, Medic 9 pulls up for an unrelated patient and delivers a patient. MTI and another private was there doing their services. We didn't advertise what was going on. They continued to do the business they were supposed to do. And while that was going on, we had to restock. And we're talking about restock right now because we have supplies that are in need around the country, certainly around the world. So myself and Captain Willett decided to go into OBC and start looking around. And that's how we usually restock. And we were able to find these about waist-high carts with PPE that was in each one of the carts outside about every third room. And inside there was gowns, masks for the patient, N95s for the provider, and we were able to restock what was utilized by Lieutenant Coltrane on the PPE level. And I think that's very important for everybody to know that we're gonna have to try to achieve or retrieve as much of the equipment as we can from the hospital, including drug IV boxes, but in this case wasn't necessary. I'm gonna turn over right now to Lieutenant Thompson from the supervisor level. What's the plan right now for Coltrane and Weaver as they continue their shift here, and now it's about 16:30 hours?
As far as I know, it's going to be business as usual. Lieutenant Coltrane was in his full PPE, so being in your full PPE, there is no exposure hazard. If you're not in your full PPE, that's when you have the potential to become exposed. I've been in contact with the Safety One, and that's where we're at right now. There's no, as far as I know, there's no nothing else going on. Just going to monitor for the next few days and see what happens.
Yeah, and we discussed as a group, which is important after any incident when we go ahead and we do our after action, is do we go ahead and notify nursing care online and make notification that an exposure may or may not have occurred? And we discussed it this way, and certainly with Chief Adams. If we go to a building fire, a structure fire right now, and we come off with our PPE on, our BA, and we go and we investigate and find no fire, no working fire, no situation, we return our gear to the apparatus, but we still prepare for the worst. In this case, based on the information received by OBC, we feel this is a low risk. It was a high risk by dispatch and EMD, ended up being a low risk after delivery, but we don't know that, kind of like going to that structure fire where somebody reports smoke or fire. I have advised that it's okay for me if they go ahead and notify workman's comp and risk management, say that there may be a possible exposure, because we know it'll be 36 to 72 hours before we get anything back if they even do a test at OBC. But that's up to the medics and the supervisor on hand. But I want everybody to know that we prepared and treated this patient as if it was going to be a positive case, and not until probably 3 or 5 minutes after delivery to OBC do we realize that maybe this was a low probability of having it. But I'm going to go ahead and ask right now Lieutenants and Master Firefighter Weaver to give one last maybe word of advice or recommendation to anybody out there that might run this next call, so we can prepare for the next one. Here we go.
Word of advice would be, get a game plan together, be prepared. The department's giving us everything we needed to be prepared, so use it. Use all your PPE properly, and good communication. Come up with a game plan.
Thank you. Lucas?
I'd just say use the training that we've had over the last week or so, and limit our exposures as much as possible. Like Lieutenant Coltrane going in initially and being the only one to potentially be exposed and keep as many people out of that atmosphere as possible.
Lieutenant?
Use your training, use your resources. There's a new COVID-19 TIMS protocol that came out today.
Okay, good.
Use your dispatch notes. If you have any questions, call your EMS supervisor. They'll be more than happy to respond and give you any assistance that you need.
Okay, very well, guys. And as we close up right now, I just want everybody to know that you have EMS 1, Safety 1, 2 battalions, deputy fire chiefs, and the fire chief available at any time to go over these difficult questions, provide guidance. You can never make a decision that's too careful in these cases, so please utilize not only the equipment that we've given, but certainly the training. And if in doubt, we're going to go ahead and gown, mask, eye pro, and glove, and then we will go ahead and worry about restocking and providing that restock to you as necessary. So thank you very much. Certainly, Lieutenant Coltrane, Master Firefighter Weaver, and Lieutenant Thompson for their great work today. And we hope that everybody has as much success as Medic 1 had today. Thank you.